Hi, everyone. Welcome to the second track of MICD. Today we have Hequn Lee that is going to be presenting another story in the chemical space of the use of PBK modeling, bottom-up PBK modeling for benzophenone 4. So let's start the presentation. Thank you so much for joining us, and Hequn, thank you so much for taking the time to present.
Okay, thank you. Hello everyone for coming, and also a big thank you to Simulation Plus for inviting me to speak, and George for the nice introduction. I'm really excited today here to share, some of our challenges that we've been facing, and some lessons that we've learned when applying PBK models in cosmetic industry for risk assessment. In this presentation, I would like to talk about the journey towards confidence, the bottom-up PBK model that we have built for this chemical benzophenone 4. Just some background information about this work. At Unilever, we make many of the world's favorite brands, as you can see, including a lot of cosmetic products. And at Unilever, we must make sure that the products are safe, and we need to make certain decisions about the safety of our products for both our consumers and workers all around the globe. And we need to make those decisions without generating animal data for several reasons. The main two reasons are regulations have already banned animal testing of cosmetic products and their ingredients in over 14 countries. And many of our consumers do not want to buy products associated with animal testing. So we have already transitioned from the traditional risk assessment by relying on animal data to the next generation risk assessment, in which we develop and apply new approach methodologies like the NAMs without generating new animal data. And as you can see, PBK modeling plays a very important role here in terms of linking the exposure scenario we're interested in and some, bioactivity data we may generate. And about this case study on benzophenone 4 or BP4, BP4 is an UV filter ingredient used in sunscreen products to prevent sunburns or photo degradation. In 2019, the European Commission defined a list of 28 cosmetic ingredients with potential endocrine activity. And BP4 is one of those chemicals for which the call for data took place. So the objective of the case study we have initiated on BP4 was to assess whether a tiered NGRA approach is sufficiently protective for this type of ingredients following the framework and NAMs applied in previous case studies. However, for this presentation, I will be mainly focusing on the PBK model development part of BP4, which was based on NAMs like in silico or in vitro data to make estimation of systemic exposure levels in NGRA. When it comes to exposure assessment, from topically applied dose to internal concentrations like plasma or tissue Cmax or AUC, there are three blocks that we always consider, starting from external exposure, modeling, to ADME data generation and parameterization, to building a PBK model so we can make predictions on internal concentrations and to understand the kinetic profile of the chemical. I will go through these three blocks with you today in my next following slides. So the software we have used in this case study was GastroPlus, the version 9.8, and these are some phase screenshots. And I need to mention that one of the specific reasons that we have chosen this software for this PBK modeling practice was because of its thermal module. It has got this magnetic complex thermal module to describe those processes of skin distribution and absorption for the chemical. Can you go to the next one, please? Yeah, and also to ensure best practice, the PBK modeling workflow and reporting procedure was all compliant with both OECD 2021 and WHO guidance. That I'm not going to into detail. And next one, please. Yeah, so moving to the first block of the exposure assessment for external modeling, the scenario that we are interested in is 5% BP4 in the sunscreen product like a body lotion. According to the SCCS note of guidance, a worst case would be 18 grams per day for 2 times, means that 9 grams per application on body and the face. With this kind of skin surface area. And in order to closely simulate the real life use scenario, and also, to better reflect the consumer practice and habits, we make certain assumptions. The first one being, because we're interested in this case, the European individuals, we assume that they use this sunscreen body lotion in the daytime only, and each day apply the first dose at 9 a.m. and the second dose at 2 p.m. Following a meal, and this individual takes a shower each morning at 7 a.m. And the good thing about GastroPlus is that we can use its mixed multiple doses function in the software to reflect these multiple doses of specific amounts at varying intervals. And next, please. Moving to the next block of exposure assessment for data generation and parameterization. I need to already mention that in this specific case study, there are no human PK data available that we can use to validate the model. So basically, not much was known in terms of BP4's biological, or kinetic behavior. So our overall strategy here is we took a stepwise approach to data generation and refinement, using very relevant and robust approaches for parameter determination in order to support the reliability of the input parameters and provide a sound biological basis for the model structure. And in this table, you can see some initial parameters obtained for this chemical. Worth mentioning that this chemical is an anion, so it's ionizable at biological pH. And next one, please. And then we moved to generate some very important parameters, including dermal absorption through performing ex vivo skin penetration study. The study was designed according to this literature listed here, meeting both OECD and SCCS guidance. BP4 was dosed in a relevant formulation, which is an oil in water emulsion. We have generated not only the time course data in the receptor fluid, but also the full time course data in the skin layers. You press the button, please. And you can see the main results shown here. BP4 has shown to have a very low skin penetration profile. Therefore, this explains the big variance of the data in different skin layers, like the big arrow bars. So the dots on those figures are the measured data in a time-dependent manner in different skin layers. However, in receptor fluids, everything was below the limit of quantification due to low absorption. Then we use this data to fit very important skin penetration parameters, for example, diffusivity and partitioning parameters in the TCAT module of GastroPlus. Once we're happy with the model, we can then translate it into a human, exposure scenario. And next one, please. Yeah, and the next parameter of importance was on hepatic clearance. Based on some initial, prediction using some in silico parameters, it shows that BP4 was predicted to be a class, ACCS class 1A chemical, meaning that it's predicting that it is mainly cleared via liver metabolism. However, some in vitro data that we have generated using primary human hepatocytes in both suspension and plateable formats have shown that BP4 was not metabolized in those hepatocytes, which is basically conflicting with this ECCS classification we have predicted. And next one. So we really need to figure out really what's happening here. We've got two hypotheses. The first one was BP4 is not a substrate of liver enzymes. And the second one is BP4 has got very, very low probability, so it has limited access to those liver enzymes. In order to confirm those two hypotheses, we have conducted some follow-up assays. The first one is to perform a S9 incubation stability assay. And again, we found there's no metabolism of parent compounds. And then we also performed this PEMPA assay focusing on passive diffusion. It shows that BP4 has got very low permeability through the lipid membrane. Based on both evidence, we can say that BP4 has got very low liver clearance. So liver clearance could be neglected in the model. But then this made us wonder if BP4 is not metabolized by the liver, what is the route of elimination, and how is BP4 taken up by the cells? Next one. Thank you. So we need to understand chemical, organ distribution and renal clearance. So basically, we dig into active transport mechanism based on certain, in silico predictions. From ADMIT predictor, it shows that BP4 is likely to be a substrate of several transporters, including these organic I9 transporters, the OATs. So we are all our renal clearance calculation based on the equation shown here, GFR multiple FUP. So we decided to go to generate some in vitro data using transporter assays. And those assays are, over transfected kidney cell line, and we've looked into in total 10 transporters as listed here, and the results showed actually BP4 was definitely a substrate of transporters like OAT1, 2, and 3, as well as the efflux transporters, the BCRP and MRP4. And all these transporters are shown to be expressed in the kidney. However, the OAT2, BCRP, and MRP4, they're expressed both in the kidney and the liver, and the other two are not expressed in the liver. But although we are quite happy with this data because it confirmed our hypothesis, it has its limitation. The first one is if you look at the mechanism, figure on the right, for the drug elimination and major transporters involved in the kidney, the blue ones that are involved in the active secretion, I think we've got a very good coverage already. However, for the purple or the pink ones, which are responsible for reabsorption, that we don't really we didn't really investigate on them. So I would say we only have got half of the picture. And another disadvantage is that at one time we only look into one transporter. Can you go to the next one slide, please? So we really want to know, and click, please. Yeah, so we really want to investigate the bidirectional transport profile of BP4 in kidney, where all the active transporters are present and functional. So we have used this approximate system to explore that. A few words about this approximate system. It uses the primary proximal tubule cells derived from fresh human kidneys, and they can be captured on these semi-permeable filters, and the tight monolayer formed can then separate the system into apical and basolateral compartments. By studying the B2A as well as the A to B directional transports, we can then investigate into active secretion and reabsorption respectively. And so you can see that the advantage of this system is they retain a high degree of differentiation, and they express a variety of functional transporters like proteins and transporters and biomarkers. We have performed this assay and by including several controls like Lucifer yellow to account for paracellular leak, and also this p-amino heparet to account for OAT transporter to see whether the assay works. And next one, yeah, and this slide shows the some of the main results. The data was first presented as flux rate, picomole per centimeter squared per hour in both directions, represented by JA2B and JP2A. These two parameters were then used to calculate this efflux ratio. And I think the general rule is if this ratio is between 1.5 and 2.5, or even higher than 2.5, it's mainly active secretion involved. However, if the value is below 1, it's mainly the reabsorption involved. You can see the three figures in the middle. These are the efflux ratios measured or calculated at different time points. So we've got 6 concentrations of BP4 tested from very low to high. Okay, click the button. Yeah. So you can see that for most of the concentrations and time points in most of donors, all the efflux ratios are more or less around 1. I wouldn't say there's a clear pattern around which direction of transport is more preferred. However, it's worth mentioning that at the lowest concentration, like this 0.32, in the donor K52, that's for all 3 time points, the efflux ratio was quite high, indicating active secretion was the main excretion route. So the overall results show that all 3 procedures are involved in the elimination of of the BP4 in the kidney. However, in most of the most data show that transport in the kidney cells is equally efficient in both directions. However, delta variability was seen that in one donor active secretion was shown to be the major excretion route at biologically relevant concentrations. And next one, please. Yeah. And since we have now got most of the data, we have then updated the PBK model in GastroPlus. You can see the structure of this human PK model below, the tissues involved. We have set each of the compartments to be modeled as permeability limited, given the data obtained from the PAMPA assay. Liver clearance was set to 0 to be conservative, based on hepatocyte data and S9 incubation data. We have accounted for this active transport procedure in the liver by incorporating kinetic parameters like Vmax, Km, protein expression for transporters. But we are not accounting for biliary excretion, also for being conservative. For renal excretion, we sticked with this equation GFR multiply FUP to only account for filtration. And this is also to be conservative because we know that for certain, like the donors or human population, it may be active secretion playing a major role. And next one, please. So once the model was built, we were then ready to make some model simulations on the scenario like this sunscreen product exposure. So here you can see this deterministic PBK modeling we have performed to make simulation for a female European individual, 30-year-old, 60 kg. You can see it on the left figure, the plasma time course state profile, and it actually shows that at steady state, kidney and plasma are shown to be the compartments having higher exposure levels. I won't go into details into those output numbers, I've already mentioned that human clinical PK data is not available for model verification, which is a limitation that we know of. Yeah, can you go to the next slide, please? Then in order to solve this issue, let's say, I want to here talk about certain strategies. Yeah, certain strategies in addressing uncertainty in PBK estimation. So you can see from the left, arrow pointing down, these are, different strategies in addressing uncertainty in PBK estimation from, I would say, low tier to high tier. The low tier would be a deterministic PBK model where everything was just single value and you're only doing simulation for an individual. So you can see from the right, the model prediction, it would be also a point estimate. However, if we account for, parameter uncertainty as well as population variability, we can get actually a distribution on the Cmax prediction that have better coverage. But then I would say a even higher level of strategy would be to account for also the model uncertainty. And then by doing so, we will get an even larger distribution. So then we are also being more confident with our Cmax prediction. Can you go to the next one, please? And then for this specific case study, we used the last strategy, the most highest level strategy. And this slide is to showing that some of the sources of the uncertainty. So based on the OECD and WHO guidance, we perform this uncertainty and sensitivity analysis. And some of the parameters shown in this table are shown to be impactful. They have either low, high, medium sensitivity, or they have, medium uncertainty. So based on the matrix, the model can be scored as a moderate reliability model. Okay, go to the next one, please. In order to account for those, different sources of uncertainty, we could perform this probabilistic PBK model, and by setting, a population of interest, as shown here, and also for chemical-specific parameters, we can set ranges of those parameter values. Can you go to the next one? In this table, you can see as an overview for those parameters, influential parameters, the kind of distribution we have applied, like lower and upper limits, distribution type, and CB%, etc. And so those were used in the Monte Carlo simulation, it's the population simulation function of GastroPlus. The next one, please. Yeah. But what we haven't accounted for, as I mentioned, would be the unknown unknowns, like the model uncertainty. So then what we did was to apply this CMAT model. CMAT is in short for Cmax error distribution model. It is a complementary approach to characterize PBK prediction uncertainty, as published previously. So what we did was, in this model, for a list of chemicals and list of exposure scenarios, which we have got certain human data like Cmax observed data, we have performed PBK modeling and simulation and compared those PBK predictions against those observed data, and then we applied Bayesian statistical analysis method to learn those distribution, like error distributions between the two. Then the idea is that for the future chemical or for a future exposure scenario, we can use this model to estimate the distribution of possible prediction errors. So you can see from the figure on the left that these are kind of different estimation outputs on Cmax obtained from different strategies. And the green one is actually the prediction, like the widest one that we got from this probabilistic PBK model combined CMAT approach. So basically we have then use this 95th percentile from this green distribution going forward in our risk assessment together with the bioactivity data. Okay, to summarize BP4's kinetic behavior in the human body based on our learning, overall, upon thermal absorption, only a very small amount of BP4 enters systemic circulation, after which BP4 remains unchanged due to negligible liver clearance. It has quite low tissue distribution due to low partitioning and limited passive diffusion. In the kidney, glomerular filtration, active secretion, and reabsorption are involved in kidney excretion. However, in most of the situation, there's no preferred direction of movement. So it's mainly glomerular filtration determines the overall renal excretion rate. The chemical can move into and then out of the liver cells. So after performing successive, doses simulation, it has resulted in accumulating concentration of BP4 in the human body until a steady state is reached around 100 hours. Can you go to the next one? So this is my final slide. So this is a questionnaire, like a table suggested by WHO guidance on PBK modeling in terms of assessing the level of confidence in the PBK model. The first question focuses on the structure and parameter, like whether they have biological base, a reasonable biological basis. I think the answer is high. How well does the model reproduce chemical-specific PK data? Unfortunately, the confidence is low because we've got no PK data. And I would say this would be the case for a lot of cosmetic ingredients, actually. And the third question is, how reliable is this model with regard to its prediction of those metrics relevant to risk assessment? I think is again high for the answer. But if we actually look at these questions closely, I think they are all targeting, the accuracy of the model. However, here I really want to invite you all to, let's say, try to change the mindset a little bit. So what if the level of confidence is towards the conservatism? Then I think our model has high confidence against all those questions. I think this is something worth considering, right, moving forwards. And I think our model is quite fit for purpose. And that's it. Thank you very much for your attention.